In an extremely unfair, geopolitically driven move, US President Trump and his colleagues kept referring to COVID-19 as the Chinese virus. They forget that the US itself has a rich history of epidemic outbreaks. Here are some of the biggest outbreaks that spread across in the United States in different periods of time. Smallpox from European settlers wiped out entire Native American tribes in 1633 to 1634. In 1793, yellow fever from the Caribbeans, which killed about 5,000. 1832 to 1866, cholera came out in 3 waves. The United States had 3 serious waves of cholera, an infection of the intestine, between 1832 and 1866. The pandemic began in India and swiftly spread across the globe through trade routes. New York City was usually the first city to feel the impact. An estimated 2 to 6 Americans died per day during the outbreak. 1858, Scarlet Fever also came in waves. 1906 to 1907, Typhoid Mary broke out in New York. Annually, 10,771 people passed away from typhoid fever. In 1918, the mutating Spanish flu killed about 675,000 Americans and another nearly 70,000 in 1957. In 1921 to 1925, diphtheria epidemic killed about 15,520 Americans. 1916 to 1955, the peak of polio leaving about 3,145 dead out of the 57,628 reported cases. 1981 to 1991, the second measles outbreak. The United States experienced another outbreak of measles in 2014 and 2015. 1993, contaminated water in Milwaukee, which infected about 403,000 and killed more than 100. 2010-2014, whooping cough, which infected about 10,000 and killed 10 infants. 1980s to present, the leading cause of early death, with about 1.2 million having HIV. Since 2005, the number of diagnoses has fallen by 19%.